More women experience urinary incontinence than osteoporosis and high blood pressure. But how much do we hear about menopause and high blood pressure and osteoporosis? But it's like more women have urinary leakage than any of those issues, but we're not getting talked about that. Like we get DEXA scans for our bone health,
right? And
we're like, oh, because we're at risk for a fracture. But if you're running to the bathroom 4 to 5 times at night because you pee your pants, or you have, urinary frequency, that's going to put you at risk for a fall.
Hello, friends. Welcome back to Better with Dr. Stephanie. It's me, your host, Dr. Stephanie Estima. And today I have a very special conversation for you. This is a topic that is shrouded in shame. It is often not discussed, pushed under the rug. We ignore it. And I am here to tell you that this is a conversation you need to hear for your own well-being, maybe for your sister or your daughter or your mother. We are talking about pelvic floor health. Yes, the V word is going to be used a lot in this conversation. So if there are littles around, maybe not in the car with them, you can listen to it another time if that is your preference. My guest today, Dr. Sara Reardon. She is a board-certified pelvic floor physical therapist with over 18 years of experience helping individuals prevent and overcome pelvic floor issues, including urinary leakage, painful sex, bladder prolapse, or uterine prolapse, discomfort during pregnancy, postpartum, and menopause. Dr. Sara Reardon, known as the Vagina Whisperer, great handle on Instagram, has been featured in Time, Yahoo, Harper's Bazaar, all the places, In Style Today, numerous other podcast publications and professional conferences. And she has a TED Talk on pelvic floor health. This is a conversation, as I mentioned, for you, if you've had children, even if you haven't had children. Pelvic floor health, really important, especially if you're a muscle mommy and looking to maintain and build on your muscles. Why not include your pelvic floor in that program for your mom, for your sister, for your daughter? Everybody needs to be talking about pelvic floor health. It is a huge disservice that we are not. So without further delay, please enjoy my conversation with Dr. Sara Reardon. All right. Dr. Sara Reardon, welcome to the show. I'm so happy to have you here today.
Thanks so much for having me, Stephanie.
We are going to talk about your new book, Floored, and it is very clever name, all about the pelvic floor and the health and anatomy and why we should be, as women, but of course men as well, why we should be paying attention to the pelvic floor in general. And I wanted to start our conversation with an anatomical overview because I think it's the pelvic floor and pelvic floor health and pelvic floor physiotherapists, of which you are, getting a lot more recognition and there's a lot more discussion in recent years. But I think people are like, but what's the pelvic floor?
Right.
Where is it? So why don't we start with just where is it? What does it look like? Go. Let's start there.
Let's start. So I am a board-certified pelvic floor physical therapist. So I went to physical therapy school, and PTs work with muscles and tissues and nerves in the body. And I work with those muscles, tissues, and nerves in the pelvic region of the body. So when we talk about the pelvis, it's those kind of bony skeletons that we see if you are in your doctor's office and you see the skeleton model. We see kind of those elephant ear type bones where the spine attaches. Or even if you just put your hands on your hips, those hip bones are actually your pelvic bones. And they form, it looks like almost a basin. So pelvis is Latin for basin because at the bottom of that basin is actually a basket of muscles that sit like a hammock, and that is what we call your pelvic floor. They attach from the pubic bone in the front to the tailbone in the back and sling side to side. In the female body, which is what the book is about, A Woman's Guide to Pelvic Floor Health, those muscles support your pelvic organs like your uterus, your ovaries, your rectum, your bladder, and they also have the sphincters for urine to exit the body, the anal opening for poop to exit the body, and then the vaginal opening for vaginal birth, menstruation, and vaginal intercourse. So they're really important.
Super important. And of course, I think we associate pelvic floor health with pregnancy, and I know we're going to talk about that today. Before we get there, Just explain to the listener how these muscles are maybe different than like a bicep or a quadricep. I mean, we all sort of think about skeletal muscle and we're like, okay, I get bicep works like this, quadricep works like this. How are the pelvic floor muscles different?
They're similar, but they're different. I think one of the biggest things about the pelvic floor muscles is we can't see them, which is why we don't even often know they exist and that they're related to these day-to-day functions like peeing, pooping, sex, even breathing and core support. But, when we think about our quadricep muscles, they're typically in a relaxed state, if we're just kind of like letting our leg hang out or if we're lying down. But your pelvic floor muscles are always working because they're always supporting your spine. They literally contract with every cough, every time you get out of a chair, every squat. So they're always working. But then they also need to fully lengthen to eliminate your bowels, to urinate, to have a vaginal birth, vaginal intercourse. And then they also need to tighten and contract to hold in urine, hold in stool. If you're in an elevator and need to hold in gas, they really kind of contract. So they kind of live in this in-between state where they're never fully relaxed or never fully contracted. But yet we have to know how to lengthen and coordinate and keep them strong so that we don't have pelvic floor dysfunction, which is unfortunately what 1 in 3 women in the United States have.
Yeah, and I think that this is potentially, and you would know the stats better than I, but exacerbated after pregnancy, 1, 2, 3 pregnancies. And I watched your TED Talk, which we'll make sure that we link in the show notes. One of the things that struck me was this idea that the baby, I had midwives, so I had like the next day, they were with me when I was birthing the baby, but the next day they were at the house and teaching me how to breastfeed. And thank God for midwives.
Dreamy.
It was a dream. It was a dream. But of course, the focus often is on the baby. Like, is the baby gaining weight? What percentile is she or he? How long, or et cetera, et cetera. They have all these checkups. But women really just get one sort of checkup at like 6 or 8 weeks and like, good to have sex. Good to,
Yeah, what kind of birth control do you want?
Right. Good to go back and exercise, et cetera. And I think that does a bit of a disservice to women because if there are some complications or healing that hasn't yet resolved itself after that 6 weeks, there's not really an opportunity for us to, other than sort of seeking a specialist like yourself, there's not that discourse, I think, in the regular checkups for a woman postpartum. And as we'll soon sort of get into, your argument in your book is that if these things go unchecked, and they're relatively easy to fix, but if they go unchecked, they can get worse and like they are progressive. So as you enter into perimenopause, where a lot of my listeners are now, issues from pregnancy can start to make things worse.
Absolutely. And it's, you mentioned it's a bit of a disservice. I think it's a huge disservice, which I think you would agree with. It's, we go through a very huge transformation during pregnancy. Our pelvic floor muscles lengthen and stretch. So regardless of what type of birth you have, cesarean or vaginal, your pelvic floor muscles have changed and weakened during just the pregnancy process. And then giving birth, you have a vaginal birth where you are more prone to urinary leakage, pelvic organ prolapse, hemorrhoids. You've had a perineal tear. 93% of women who give birth vaginally have a perineal tear. So there's actually scar tissue at the vaginal opening where the muscles are, where they can't relax or contract as well, leading to incontinence or pain. And even a C-section, there can be scar tissue restriction in the abdomen that leads to constipation, incomplete bladder emptying, menstrual pain, painful intercourse. So, and to your point, we maybe get a 6-week checkup, and 40% of women don't go to their postpartum visits. And that's a bigger societal issue.
Whoa,
yeah, 40%.
That is a terrible stat.
Yeah, because which means there's no postpartum care. So, if we think about it, there's no child care. There's no paid maternity leave. People go back to work within 2 weeks sometimes. So it's just one of those things that it's a real systemic challenge to get women the health care that they need. But because of this, their pelvic floor goes unattended to. And with every continuous pregnancy and birth, and then once we kind of go into perimenopause, which can start in your late 30s, early 40s. So sometimes we go from postpartum to perimenopausal, and it feels like one blurry season. We don't even know we've entered a new one. And then your hormone levels start to decline and be a bit of a roller coaster. So we don't even have that to kind of help prop us up in our pelvic floor anymore. So it really is, I think, a tragedy that women are not getting this pelvic floor health care because we know pregnancy, childbirth, and menopause are all risk factors for developing it. Every single woman will go through menopause, yet we're not giving her the care that she needs in this pelvic health arena.
Yeah, and you mentioned a couple things. I wanted to just double click on this idea that the pelvic floor also helps you breathe. You talked about this in the book, and I was like, oh, that's of course it is. It's part of the core, right? From
right,
the core,
it's part of the
diaphragm
core.
to the pelvic. So just talk about that. I mean, that was something that just jumped out at me that I wanted to make sure to highlight for our listeners as well. Tell us how the pelvic floor is involved in breathing.
So the pelvic floor sits at the base of your abdominal cavity. All of your pelvic organs rest on top of it. At the top of your abdominal cavity is your diaphragm, which is your breathing muscle, and it sits underneath your rib cage. When you inhale and take a big deep breath, your diaphragm actually kind of pushes down and flattens out. And when that happens, your pelvic floor softens and relaxes with that. So think of it like a piston. Like when you inhale, the pelvic floor relaxes. When the diaphragm goes down, when you exhale, the diaphragm lifts back up into that dome and the pelvic floor can come up. And that's all to maintain a certain amount of pressure in your abdomen. What can often happen is when we hold our breath, which we do when we are lifting heavy weights, sometimes when we're straining with bowel movements, when we're pushing during a vaginal birth, it kind of locks that pressure in and can lead to weakness. It can lead to weakness on those muscles over time. And so we have these habits that we've never really been trained or untrained to do that could affect your pelvic floor. So one of the biggest things I teach people is like, you need to breathe. And I see a lot of women who actually have pelvic floor tension, so they shouldn't be doing Kegels, but even just a simple exercise of breathing can help soften and relax their pelvic floor to release some of that tension that they're holding.
I mean, this is a bigger conversation, but I can also tell you that from spending 19 years or so in private practice, nobody knows how to breathe properly. Everybody's
Correct.
breathing with their, everyone's
Chest.
breathing from here, right? It's like, they're just sort of breathing with these superficial muscles of respiration versus the diaphragmatic belly breathing and really, really sinking into it. You bring up such a good point around, and I love your work as an overall, because I think pelvic health and the postpartum issues that women fall into are shrouded in shame. And you mentioned incontinence just very quickly, and I thought we could just go there for a moment, because I remember I took my kids to a trampoline park. I can't remember, like it was someone's birthday, or maybe we just took them there for fun or whatever. And I remember posting it online, and I had women DMing me like, how I could never.
How are you doing that? Right.
How are you doing that? Are you wearing a pad? Like I could never do that because I would literally soil, like I would pee myself. And so let's talk about urinary incontinence. I think that this is one of the things that nobody wants to talk about this. So we're going to definitely talk about it. So
yeah, that's my specialty. Yeah. Peeing and pooping, my favorite two topics.
Yes, let's go there. So let's talk about the different types and what that might look like. And then you mentioned Kegels, which I want to talk about as well.
So, urinary incontinence is when you unintentionally or involuntarily leak urine. And there actually is no amount of leakage that is considered normal for a woman. So it's common, but it is not normal to leak when you cough, leak when you sneeze, leak when you're running or jumping. And what happens is that those pelvic floor muscles support the bladder and they close the urinary sphincter to prevent urine exiting at an inconvenient time. If that muscle gets weak or too tense or incoordinated, it's not going to activate that we need it to at the times that we need it to. So stress incontinence is when there's leakage with pressure. So pressure from a run, a jump, a cough, a sneeze, a laugh, where that sphincter, often it's weak, is not supporting that bladder and closing it off when urine tries to exit. Urge incontinence is that leakage that happens when you've got a really strong urge to go. So I see a lot of women have this when they're washing their hands and the sound of water kind of triggers the urge, or they get home and they're putting their key in the door and they have a strong urge and they can't hold it in time. Or you're getting to the bathroom, you're on your way there and you can't quite make it. That's urge incontinence. And those are two different things, because oftentimes we just focus on Kegels to tighten the pelvic floor. But with urge incontinence, sometimes you can have over tense muscles. So the muscles are like too tight and they're not signaling to the bladder, hey, I'm full, chill out bladder, I'm going to go in a little bit. And so that signal kind of keeps going on in the bladder and then you just leak yourself. So it is important to discriminate which type of leakage you have. You can tell just from listening to this, you can have either of those or you can have both. Some lucky folks have what's called mixed incontinence, where they get stress and urge incontinence. But it also helps you know which pathway of treatment to walk down, because not everybody needs pelvic floor strengthening or Kegels. A lot of people need relaxation and softening and lengthening the muscles. And then if there's weakness, they can work on strengthening. So it's unfortunate, because I think our whole history as women has been like, tighten your vagina, pull in your core, better sex, do your Kegels, when It's like saying if you have back pain, just do a bunch of crunches. It is so much more sophisticated in how to approach a pelvic floor issue than do Kegels.
Yeah. Let's talk about the name Kegels just for a moment.
That they're after a man, which is like...
A man has named the contraction of some of the muscles in the vagina and, of course, through the pelvic floor after himself. How lovely.
Yeah, not surprising. But, Arnold Kegel was a researcher, and he did a study on inserting a device into the vaginal canal of postpartum women and assessing the strength. And the contraction of this muscle to assess the strength is a pelvic floor muscle contraction, but named after himself, he started calling them Kegels. And so that is kind of the universal name now. And if my life's work may be just trying to change that name because I feel like there could be a better name for them. But I refer to them a lot as Kegels because it's a familiar term, but they're also just pelvic floor muscle contractions, which is thinking about stopping your urine stream, holding in gas. It's the kind of the front and the back part, a squeeze and a lift of the muscle to support the pelvic organs and close off those sphincters.
It's almost like if you were zipping up a zipper, it sort of feels like that, like sort of in and up. And there's a scene, and maybe we'll put this in for when we promote this on social, but there's a scene from Sex and the City. I think that the four girls are at a bar or they're at a restaurant, and they're talking about one of them had given birth, so they're talking about the importance of Kegels, postpartum or whatever. And then Samantha, the sort of very,
racy, yeah.
Racy, yeah. So she's like, I'm doing them right now.
Right.
Like very demurely, she's like, I do them all the time. I'm doing them right now. And it was such a great moment for, I guess, pelvic floor health. But I love in your book, I'll just read this out. A friend of mine recommended we started calling them puss-ups.
Right. Which is a genius term. And I'm like, I back that. Let's go there, So.
I love it. Okay, so a Kegel, from what I'm understanding, and redirect me here, but for strengthening.
Correct.
A weakened pelvic floor. So give us like a clinical itinerary or checklist, let's say. If someone has a weakened pelvic floor, what might be some signs and symptoms that she might experience?
So I think some of the common ones, and I actually go through this in the book because without seeing a pelvic floor therapist in person, it's like, how do you really know? But there's some general pathways that, people fall into with weakness and they need strengthening in Kegels. Typically, urinary incontinence is one where there's leakage. Another one is actually fecal incontinence. So we don't think about leakage of stool, difficulty holding in gas, or even fecal staining, which is like smearing in your underwear, feeling like you can't get clean all of the way. Pelvic organ prolapse, which is when your pelvic organs aren't as supported by your pelvic floor and they start to kind of push into the vaginal canal. It's actually very common. I would say most women after giving birth have some sort of pelvic organ prolapse. But again, it will progress with time with increasing activity without rebuilding your pelvic floor and your hormonal levels changing with age, your estrogen levels, your testosterone levels decrease, and those kind of help plump up the pelvic floor so we don't have that hormonal support as we age to help pelvic organ prolapse and leakage. So I would say those three, but even things, we think about, Stephanie, like hip pain, back pain, weak core muscles, this what we call diastasis recti, where, you have given birth and it still looks like your belly is pregnant, but you don't have a baby anymore because your core is so stretched out. These really common postpartum issues that I think women experience, and they don't realize that there's help for them. They're just kind of like, oh, I guess this is just my new body or my new life and I have to deal with it, which is not the case.
Yeah, and to your point around the importance of getting checked, I mean, there's so many things that can overlap. In the book, you had put a couple of lists together, and one of them was decreased sensation with sex and weakened orgasms, which certainly can be a weakened pelvic floor.
Absolutely.
And it can also go in tandem with decreased sex hormones as you're going through perimenopause, et cetera. So I do think that it is really important for us to be getting checked out. And would you recommend, before I want to talk about lengthening, because I think you had mentioned fecal incontinence, but I think constipation is also worth chatting about here too. But before we get there, do you think it's worth, like, if any woman who's had a baby, do you think that it's worth it, even if the baby is now 15 or the baby's 25, is it worth going to a pelvic floor therapist to get checked out to make sure that there isn't any asymmetries or tightness or or the maybe prolapse that has persisted and now potentially getting worse? Is that your recommendation?
100%. I mean, in my ideal world, every postpartum mom would see a pelvic floor therapist at 6 weeks postpartum, just like they see their medical providers. And then if they need additional work, they kind of continue pelvic floor therapy. We know that those first 3 months are really important, and the first year, because if someone's still experiencing an issue at 3 months postpartum and it doesn't get addressed, they're likely to still be experiencing it at 1 year. However, it's never too late to go. I mean, I've worked with, women who have had teenagers, they have 30-year-old children, and, they have C-section scar restriction and it's causing incomplete bladder emptying and UTIs. Or they have scar tissue at the vaginal opening and they're like, sex has never been the same, and now they have vaginal dryness and they have pain with sex. Or, with aging, their orgasms are getting weaker and now they may even leak during an orgasm. So all that to say, you don't even have to have a problem. I'm just go in and get evaluated. Every state in the United States, you can get a physical therapy evaluation without a referral from a physician. So if you have a physician who's not willing to provide one for you, you can literally just walk in and get an evaluation. And if they will say, you're doing great, maybe here's a couple things to think about, or actually we're finding a little bit of weakness. How are you peeing? How are you pooping? How are you exercising? And they can really put you on a path of healing and healthcare. And, perimenopause, which I'm in right now as well as a 42-year-old woman, it's not great, it's a little bit of a mystical time where you're like, oh, why is my hair falling out? Is it stress? Is it hormones? Why are my poops hard? Why am I, a raging mom 3 days out of the month? But I also think that it's an opportunity. And because we're getting a runway that we know our hormones are going to change. I think with pregnancy and birth, it's such a quick change. It's happens all of a sudden, and then you have a tiny human to care for as well. With perimenopause, we get this runway where okay, it's coming. Start your strength training. Start your optimal bladder and bowel habits. Take care of your nutrition. So you can really start building in these habits to optimize your lifestyle. So when menopause does hit, when you haven't had a period for a year, you are in better shape and have better pelvic floor health than you would have if you hadn't done anything.
Yeah, I can't love that more, because one of the through lines of the show is get your ducks in order, right? It's I am a really big proponent. I'm a chiropractor, so of course, bone health and, the skeletal system, the neuromuscular skeletal system, really big area of focus for me. It's build your muscle. Don't be sarcopenic. Don't be osteopenic, so that when you do lose those hormones, let's say, that you have you've stacked the deck in your favor. And it makes perfect sense to me why you would also loop in pelvic floor health there. You don't want to be going into perimenopause and then the eventuality of menopause with a weakened pelvic floor, because it's not that it can't be changed, as you're saying. It certainly can be.
Oh, it's so fixable, right?
So, but it's just better. Name of the show. It's better if you can start earlier, right? It's the best time to start was 10 years ago, and the second best time is today.
Yeah, I love that. I really do. And the research is clear. It's women know more about. More women experience urinary incontinence than osteoporosis and high blood pressure. But how much do we hear about menopause and high blood pressure and osteoporosis? More women have urinary leakage than any of those issues, but we're not getting talked about that. We get DEXA scans for our bone health,
right? And
we're because we're at risk for a fracture. But if you're running to the bathroom 4 to 5 times at night because you pee your pants, you have, urinary frequency, that's going to put you at risk for a fall. Let's backtrack and look at the source of some of these symptoms and why our habits are the way they are, than just oh, let's check your bone health, let's check your cholesterol, let's check your heart health. I'm your pelvic floor can change your whole life. It's one of the number one reasons for admission to a nursing home later in life is fecal incontinence and urinary incontinence. And so if you have one of those two things, you're at a higher risk of ending up in a nursing home than if you don't. And I think that can really help kind of put an alarm bell for something oh, I really do need to address this, because it's not going to get better with aging.
Yes, well said. Okay, so we've been talking about the pelvic floor that is weak potentially. So this urge incontinence, stress incontinence, maybe the weakened orgasms, the pelvic organ prolapse, as you've been discussing. In the book, you talk about, I think you call it a knack. So I wanted you to share that here.
It's a good one. It's a good tip.
Yeah. So why don't you share your tip?
So one of the things that happens with our pelvic floor after pregnancy and birth, but even just with aging, is that it just doesn't fire as quickly as we want it to. And so even if you're doing pelvic floor strengthening, you have to learn to turn those muscles on when you need them to work. So if you're leaking with a cough or a sneeze, I encourage you to kind of Kegel before you cough or sneeze. So I say Kegel before you cough, squeeze before you sneeze, because that's going to activate those muscles before the pressure of the cough or sneeze. So when it's coming, instead of just kind of letting it happen, Kegel, contract, and then cough or sneeze. And especially if you're chronically coughing, I'm like, sit down, give your pelvic floor a little more support if you're having a coughing fit. That's going to help you cross your legs and Kegel if you are sneezing a bunch and you're standing. You really want to turn those muscles on as much as you can to counteract that pressure. And it's a really easy way to kind of try to eliminate the leakage that could be happening during the day.
Fantastic. I love that. Good actionable takeaway. Okay, so let's transition from maybe a weakened pelvic floor to one that needs to be lengthened. And I wanted to actually talk about this in the context of constipation. In the book, you talk about constipation being one of the number one complaints. And there's different types of constipation, which we can get into. But one of the number one complaints in the country. So when is it that our pelvic floor is actually too tight? What does that look like? What are some of the clinical signs and symptoms?
So what's normal to have a bowel movement is 3 times a day to 3 times a week. Optimally, I would say it is once a day you should be going, but if you're going every other day and it's pretty regular, that's within the normal range. If you're going longer, every 3-4 days, once a week, if you're having hard stools that come out like pellets, if you're straining with bowel movements, if you have tearing or bleeding, if you have hemorrhoids, or even pencil thin poops, like your poop is soft, but it's coming out really thin. It's like squeezing toothpaste through a tube. It's likely that your anal sphincter and pelvic floor muscles are too tense or tight. And what happens is that if you can't relax those muscles well, if they're tight or tense, or you can't coordinate the relaxation of them, the poop doesn't empty. And so then it gets stuck, it gets hard, it gets dehydrated, and then it gets more painful to eliminate. When we have pain, we tighten up even more. So then you get stuck in this cycle of tension. And it's actually really interesting because I think we have such an epidemic of childhood constipation now that adults are moving into their older years and they already have constipation and they already had pelvic floor tension and a sleepy colon. And it's like we're kind of swimming upstream because they don't have the optimal bowel habits that, we've never been taught. You see little kids, toddlers squatting in the corner to poop. And I'm like, that's a great physiological way to poop. That's optimal. But the flip side is kids hold it for too long, or even adults hold it for too long because we don't want to poop in Target or at work, or we're embarrassed about the smell. And then we lead ourselves into this constipative state. So you really do need those muscles to relax. My biggest tips are to use a little squatty potty or a stool under your feet when you're pooping. That puts you in more of a squatting position. That's the physiological way to poop. To exhale, to really avoid straining when you're pushing out. Holding your breath, again, locks that pressure in and can actually tense your pelvic floor muscles instead of relax them. So blow out like you're blowing out through a straw, you're blowing out a bunch of candles, and you can push or bear down. But you need to keep your poop pretty soft from nutrition, hydration, even if you need to take some magnesium, citrate or oxide occasionally, but you've got to keep your poop pretty soft so that your pelvic floor can relax to empty as well.
And what would it be maybe if a woman is feeling pain, maybe inserting a tampon? Would that be an indication? Or like we talked about constipation, or maybe she's going to have her annual checkup and the speculum just feels like it's ripping her apart. Like, what are some what are some of the ways that we can say, I wonder if I'm too tight?
Yeah. So I would say pain is information from our bodies that something's not working the way that it should. And inserting anything into the vagina, whether it's a tampon, a speculum at a pelvic exam, a finger, a dildo, a penis, inserting anything should not be painful. These are muscles that are relaxed. There should be lubrication naturally in the area. And so if those muscles of the vaginal opening are too tense or tight, or if you have pain with deeper insertion, it feels like bruisey, or you're hitting something, or there's pain after sex, those are often muscle spasms that are causing painful insertion into the vagina or pain after. Other things we don't think about, like tailbone pain or pain with sitting, painful bowel movements, all of those things are really associated with pelvic floor tension and pain as well. So in these situations, we want to work on relaxing the pelvic floor with breathing, as we mentioned, with yoga stretches like child's pose or a deep squat, with a lot of external massage to the hips and thighs, and then also internal vaginal massage. I've got some kind of instruction on how to do this on yourself in the book, because we need to soften these muscles. It's like having a headache and you've got really tight shoulder muscles. You don't want to keep doing exercises for your shoulders. You need to soften and relax those muscles and then retrain them once they're in a relaxed state.
And in the same way that incontinence was sort of an indication potentially of a weakened pelvic floor, would you say that pain with urination or frequent UTIs, would that be an indication that things are overly tense?
Yeah, so frequent UTIs, I think that can happen. One, it happens with aging because the microbiome of our vagina and urethra change, so you're at a higher risk. But I would say that means you're not emptying well sometimes and that you have more bacteria in your urine. Also, people who pee a lot and who leak a lot, they actually start to dehydrate themselves because they don't want to drink water because they'll have to go again, or they don't want to drink water because they'll leak when they run. But then your urine gets really concentrated and you're at a higher risk of even more leakage and even an infection. So I would say, yes, those are some signs that you likely have tension. But even once you release the tension, you may find that there's weakness there. You may find that you are leaking because you're holding it in so much. Your muscles are so tight to prevent the leakage. But once you relax them, then you're like, oh, I feel like I've got prolapse now and so you can start strengthening. So I would say pain's definitely a sign that you might have tension, but you may find that even after you release that tension, you need to work on some of the strengthening as well. It's interesting. I mean, these are like muscles like anywhere else. You can kind of be gripping your core all the time to like have tight abs, but it doesn't necessarily mean they're strong. It just means that they're tight.
What do you think about hypopressives? This is something that I would prescribe all the time postpartum, but just on their back and like sort of sucking the belly button almost like in and up, almost like, right? What are your thoughts on hypopressives? Do you like them, not like them? Where do they fit in, if at all?
I think I'm pretty neutral on them. I'm not trained on them. They're really popular in the UK and also in Canada, some places in the United States. I don't think that there are any negative effects of them. I think it's absolutely one way to kind of work on creating pelvic floor activation. Ultimately, what they are is kind of using your core to kind of suck in to create a vacuum to help lift that pelvic floor up. So I definitely think there's one type of exercise. It's a little tricky to kind of get the hang of it at home. There are people who can instruct you on how to do it. I don't think there's negatives, but I think it's just another way to kind of really optimize pelvic floor health. But nothing's the holy grail. I mean, I think what I see a lot in pelvic health care right now is we want like a magic bullet. We want to sit on a vibrating chair for 30 minutes and have like, the pelvic floor of a 19-year-old, or we want to put a laser wand in our vagina and hang out for 30 minutes and like rejuvenate our vagina. They're all very temporary fixes. Sometimes they're not even helpful. They're often costly, and they're short-term effective, if effective at all, because you have to get to the root cause of what is contributing to these issues. You can put that wand in your vagina every day, all day, but if you're not peeing and pooping right, or breathing properly when you lift, or activating your pelvic floor when you need it, like you're not ever going to get to the point where it's really healthy and functional. So we're in a state of wellness right now where we want to do the easy, low-hanging fruits, but there is no one magic bullet. It's really looking at everything: diet, lifestyle, posture, and pelvic floor health and muscle states to optimize this part of our body.
Yeah, I love what you're saying. I think that I see this a lot where people want the passive care versus the active care, right? So like the wand would be something passively that maybe you do, or maybe you're working out some knots or something like that. But you also need to be able to create a mind-muscle connection, right?
Yeah.
You need to be able to connect to the pelvic floor the way that I counsel people to connect to their glutes or connect to their quadriceps or whatever when you're doing whatever, like a squat or lunge, whatever exercise. I think it's also important that we actively connect to these areas that we're trying to ameliorate, because otherwise, you can do all the passive, you and I learn like passive range of motion and active range of motion. Like passive is always going to be easier because someone else is doing the work for you.
But you've got to learn, you got to learn to fire the muscles. And, and I don't put the onus on women completely, because we were never taught about this part of our body. When we are young, we maybe get like a book about periods and a box of tampons or pads. And then you get like a 2-week course on sex ed, if anything, about egg and sperm. Like you're never taught about your pelvic floor health. You're not even taught how to insert a tampon or a menstrual cup. You're not taught the optimal ways to pee, or you're not taught the optimal ways to activate your pelvic floor in cheer or dance or volleyball, which are put you at a high risk for urinary incontinence. We're not even taught that sex shouldn't be painful. Right? We're taught it's bad. We're taught that like we shouldn't do it, but we're not really educated on this part of our body. So we're coming to women now at a later stage in their life when they're experiencing dysfunction, and it's not their fault. This is not a part of healthcare. It's kind of just been brushed under the rug, or the narrative been it's normal, or there's a whole aisle of incontinence products. Like, here you go, ladies, we've got you covered. And I'm like, First of all,
Yeah.
it's complete bullshit, because I think if the
Yeah.
other half of the population was walking around with these problems, there'd be a lot more research about them.
Yep.
And two, we are in a time in our healthcare where we're trying to pull away from just putting Band-Aids and pills on everything. Let's get to the root cause of why you're experiencing some of these issues, and it can literally just change the course of your life.
I love that. And you've been so generous with talking about the differences and some like action items for, the knack if you think that you are incontinent, holding, or, if you're about to squeeze before you sneeze. Let's talk a little bit about some other solutions that we might think about. So we've talked about some physical solutions. You talk a little bit about foods that might irritate the pelvic floor. And to just stop here for a moment, tell me, what are some foods that we might be consuming unknowingly that may be causing issues with urination, defecation, and all the things?
So there are some common bladder irritants that people experience, and you don't have to avoid these, but if you do have bladder urgency or incontinence, you're going to want to be aware of when you consume them, because it'll increase the risk of it. And it's unfortunate that it's all the good stuff. So it's coffee, citrus juices, wine, sparkling waters, anything acidic, anything alcoholic. They're all diuretics or they're bladder irritants. So what happens is when you consume them, they go to your bladder. It takes 30 minutes for something from mouth to bladder. And your bladder's like, oh my gosh, this is really irritating. I need to get it out. And then you need to race to the bathroom. And if you don't have that pelvic floor function to get to the bathroom in time, you're at a higher risk of leakage. So I tell people, I'm like, it's fine to have a cup of coffee in the morning, but if you know that you have a really big meeting and you don't want to rush out of there and you are afraid you're going to, leak, then I would probably wait. Or if you're going to a party or a football game and you know that like beer makes your bladder like really urgent, or you're afraid you're going to leak, then like I would hold off on the sparkling drinks or carbonated drinks and the beers, because that's going to put you at a higher risk of leakage in a situation where you're not comfortable. So you can work on these things, but you just want to be aware. And the same thing with planes. I'm like, if you get a juice and you can't get to the restroom in time on a plane, like you just want to be aware of when you consume them. On the flip side with constipation, gosh, so much of what we have in our daily lives for food is constipating. Anything pretty much in a package. Anything processed in a package can contribute to constipation because it's harder for your system to break down. You definitely want to focus obviously more on like natural foods, like, beans and grains and fruits and vegetables, and, just thinking about how easy it is for your system to break something down is going to optimize, I think, how quickly it moves through your gut. It should be anywhere between 2 to 3 days from when you eat something to when it comes out of your butthole as poop. And so what I tell people is to eat a piece of corn, like eat a corn on the cob, because corn kernels don't break down, and then look for corn poop in the toilet when you go to the bathroom. And so that tells you how many days it takes for something to get through your system. And if it's 5 or 6 days later, then your system is moving really slowly. If it's 1 or 2 days later, you're like, great, that's like, I'm in good shape here. But if it's taking a long time, then your gut is moving too slowly. And I would move much more towards smoothies and broths and things to give your system some time to rest, to push the stool through.
What about constipation from travel? Do you ever see that a lot, where people might travel?
Vacation constipation. Yeah, I do it. I get myself. We're out of sorts. Our routine is different. We're dehydrated. We're eating out much more. We're eating kind of quick on the go foods. I was traveling for work a few weeks ago and I ate a bag of Chex Mix for dinner. And I was like, oh, Sara, that's going to do great for you tomorrow. right? We don't have our little squatty potties in our hotels. Our system's off. So what I do tell people is be prepared for that. Bring your water bottle. I bring little magnesium citrate gummies with me that I take every night that can kind of have a little bit of a gentle laxative effect. You really need to move. I think movement is key. There's research to show that even just 30 minutes of physical activity a day can help stimulate a bowel movement. And then even doing a little abdominal massage. I do this on myself. I do it on my kids if they get backed up. I have a demo of how to do this in the book, but just moving your hands kind of in a circular motion around your abs where your colon is helps kind of release the restriction around the colon and can stimulate a bowel movement. So many things you can do. You just have to do them. It's the hard part. Like it just doesn't happen naturally, but they're really easy, low-hanging fruits to kind of just incorporate into your life.
And I just have a question. You may or may not be able to answer this, but as you were talking about the foods that irritate the bladder, is it that it's irritating the bladder line? Like, do we know what It's the lining of the bladder that, okay.
Yeah, so the inside of the bladder is what's called mucosal tissue. So think of the inside of your mouth, right? That's like a mucosal tissue that's kind of always a little bit moist. The same thing for the inside of the bladder, but you also have a lot of vascularization on the inside of the bladder. But think about if you have like a little tear or something in the inside of your mouth and you drink something acidic. It's like, oh, that doesn't feel good. You have grapefruit juice. Or if you have something that's really tart or pungent or sour, it's like your mouth is like, it doesn't like really taste good or feel good, or vinegary. That's the same thing that can happen to your bladder. And it's not for everyone, but if you already have a little bit of an irritated bladder, overactive bladder syndrome, painful bladder syndrome, it's going to heighten that sensitivity to that, what you're consuming. So I do say if you are going to have one of those things, actually drink water with it. If you're going to have coffee, follow it with water. If you're going to have grapefruit juice, follow it with water, because then it will dilute in your bladder and it won't be as irritating or sensitive.
And that makes sense why some spicy foods also can cause that as well, because once the spicy food sort of, the remnants of it get to the bladder, then if there's that irritating on the mucosal lining, then you're going to have that.
It's inflammatory, right? Those are kind of inflammatory, heated foods. And the same thing with pooping. I mean, I talked about constipating foods, but you'll find that like dairy, fried foods, fatty foods, all of those things can really actually irritate your bowel. Wine, beer can irritate your bowels as well. And so it's just something that like we know if we have like that heavy, greasy meal, like you sleep really poorly, but can also just really irritate your GI tract, and like you'll have much more loose stools, and that will cause irritation as well.
Let's talk about what are some things we want to be thinking about in perimenopause. I mentioned a couple of them already, but I'm thinking about this more from like a physical perspective. I feel myself when I'm coming down, let's say when I'm doing a squat or a lunge, where I'm increasing that intra-abdominal pressure. I don't have any issue there, but I know I've had women who've DM'd me on Instagram. They're like, I don't know how you squat, what you do. Like I pee, like every time I squat, I pee. So what are some things if we are, if strength training is on the menu, but every time they're, either some type of burst training, like some type of high intensity interval training, or, or they're lunging or whatever, what are the recommendations there? Do we have to back off of that either in weight, volume, intensity until we can create some stability in the area? What is the best recommendation there if that's something that someone's dealing with?
Such a great question. And, I love fitness and I'm such a huge fan of it. And even now I'm in the same camp as you. We need to build muscle strength, and pulling your pelvic floor into the workouts you're already doing is so essential. So when you're squatting, you need to be activating, sucking up that smoothie with your vagina, zipping up your pelvic floor before you even start moving. Remember, this muscle's getting tired. It works all day to support our posture. So you need to be activating it or pre-contracting it before an exercise, and exhaling. So avoid holding your breath. The other thing is that if you're experiencing leakage, prolapse, pain during an exercise or at some point in your workout, that means your tissues are being pushed past what they can hold. So yes, the recommendation is to pull back, drop your weight, drop how quickly you're doing your moves, slow it down, make sure that you're using optimal posture and mechanics and breathing and pre-contractions. And then you want to build up your pelvic floor strength before you kind of increase it. The other thing is, I'll give everybody a hack here. There are these things called internal bladder support. So if you're leaking, it's likely because your bladder is pushing into your vaginal walls because your pelvic floor is weak. And so all of that pressure is causing leakage. You can insert a tampon or a pessary, which is prescribed by a medical provider, or an over-the-counter bladder support. There's one called Revive. There's one called Poison Preza. And it looks just like a tampon that you kind of insert in there, but it just props up your pelvic floor and your vaginal walls to support the bladder. And that may help you give you more support while you're lifting and loading and make a world of difference. You still need to work on your pelvic floor. You still need to strengthen. You still need to activate. You still need to breathe properly. But that at least just kind of take some of the fatigue off of the muscles while you're trying to strength train. So the other thing is, look at how you're moving. A lot of people, when they are postpartum or getting into working out, I'm like, start in sitting. You've got pelvic floor support in sitting. Do some things in sitting where you don't have all of that gravity pushing down. Get into hands and knees position, planks, side planks, mountain climbers, use an incline bench. So there's a lot of ways to modify things before we get into a way upright position and load and impact. So a lot of variations. I have a whole online pelvic floor program to really get people back to running and lifting, showing them how like, okay, start, it feels easy, but really build that foundation before you just start kind of building the house and loading things on top of it.
Okay, that's awesome. We'll make sure that that link is there too. And thoughts on Pilates for improving core strength? Do you like it? Not
Love
like
it.
Neutral? Love it.
Yeah, I love Pilates. I think it's great. But again, you have to be pulling the pelvic floor in, and you also have to be relaxing the pelvic floor afterwards. I think Pilates, bar, a lot of these workouts are all about like tightening, and you do that for an hour. But afterwards, you also have to relax the pelvic floor. You need to soften it. You need to balance it. You need to do some stretching and breathing to make sure that it gets back to its optimal resting tone. And I think that's what I see is with Pilates and bar, they're great, but the focus has to be on balance and not just on like tightening.
Yeah, that's why I love Happy Baby. I love Happy Baby pose.
Love Happy Baby.
I actually do it before and after my Pilates class. It feels
which is so great.
Good. Yeah.
It's a great one because even, we walk around with a lot of tension in our body. So doing a little bit of breathing and stretching before the workout, so you know your pelvic floor is an optimal length. Do your workout and then do it afterwards. Do the stretching afterwards as well, or do it before bedtime. We walk around with so much tension in our bodies from sitting, from stress, from waiting in the carpool line to get my kid, from just life, from just modern day life. And that creates tension in our bodies, right? Yeah. And so just giving your body the opportunity to soften and relax is as important as the strengthening and tightening.
I've seen a lot of, this is more power lifters, but I've seen some women do this too, where they're wearing belts when they're squatting. And this might be for an axial squat. So like, you're having a barbell on the back. So you're like loading the spine, which is not for everyone. So there's lots of different ways to squat. You can squat with your hands at the side. You can do a belt loaded squat, lots of different ways to squat. But particularly with axial loaded squats, where the barbell's on the shoulders in some capacity, high or low bar, I see a lot of belts. And I think that I don't wear one, but what I've garnered just from listening to people talk is that it helps them to sort of breathe out and brace almost against. So having like a physical brace against something as you're coming down in the squat. Is that something that you like, don't like? I'm just throwing a little bit of
it's a great
rapid
question.
Fire at you. Yeah.
No, I would say I don't like them when the mechanics are wrong. So we talked a little bit earlier about that intra-abdominal pressure. And ultimately what those belts do is they try to direct where the pressure's going. They're trying to prevent it from going to the back or prevent it from going to the abs. Well, where's it going to go? Down.
Yeah. The pelvic floor, yeah.
The pelvic floor, which is why
exactly.
people leak and they have hemorrhoids and they have prolapse and rectal prolapse when they do that. I know that people are making those choices because the lifting is important to them. And I'm like, girl, you do you. Like, you are a powerhouse and go for it. But I want to tell you, it will catch up with you over time. So as long as you know that and you're making an informed choice versus being like, oh, I just peed my pants. Well, I'm actually like, well, now your bladder's falling out of your vagina because of this repetitive lifting and poor mechanics. So that's, as long as you're aware of that's the situation, and you will have to likely have it surgically, corrected. And 30% of women who have their prolapse surgically corrected have to get it redone because they're not getting therapy after. They keep doing the same things. Just know that that's what's happening. And so I'm like, I get that that's going to happen, but I just do want people to be aware of why it's happening so they can understand their bodies.
Okay, so the other thing I have to bring up is waist trainers.
Oh.
So these sort of like corsets that appear to make your waist look smaller. And I think as you were talking, I'm like, oh, this is what I actually think a waist trainer's doing, because it's squeezing you in at the waist. Thing. But it's like, where is the pressure?
Where's the pressure going?
Yes, tell us about that. So
I'm not a fan of waist trainers. So because, when they often happen, when we often use them is after giving birth and we want to shrink our waist down. Well, think of like you're holding those long skinny balloons that they use to like make the little, wiener dogs or whatever balloon animals. Think if you've got one of those long skinny balloons and that's your kind of intra-abdominal cavity with all the pressure. If you take that balloon and you squeeze it in the middle, where's all that pressure going to go? Up and down, right? Well, after giving birth, when we use these waist trainers and squeeze our middles, all of that pressure goes down on a really vulnerable pelvic floor. And your pelvic floor is functioning at less than 50% at 6 weeks postpartum. So you're putting all of this pressure down on it when it's in a really vulnerable, weakened state. And I've had women be like, yeah, I wore this, and then I bent over and I peed my pants. I'm like, because there's so much pressure going down on your pelvic floor because it doesn't have anywhere to go because you're cinching your waist in. in. What I really love for postpartum is compression from the bottom up. So there are these amazing supports that you can have where they go under, they're like underwear, but they go below your pelvic floor and they lift up. So they kind of like pull you up and in, and it's a gentle compression. It's like a little sports bra for your vagina, your vulva, and your core. But it's not a trainer. It doesn't have, bra cinchers or snaps. It's compressive and supportive. And, I think if we build in pelvic floor and core retraining in these early days and those first 12 weeks, it's going to help people have more of that internal support than trying to rely on these external supports, which could be potentially, not helping and even harming. But compression, vaginal support, vulvar support, abdominal gentle compression, but not a waist trainer.
I love that reframe because I'm asked a lot about waist trainers. Do they work? Should we wear them? And I just feel like if you have a stronger core, which includes the pelvic floor, your waist, and then you have the right diet and the right movement pattern, the right stress management, you're going to have a beautiful waist. And then if you're building your glutes and you're building your quads, you have that beautiful quad sweep and calves that you want to take a bite out of. Like you're gonna be fine. Like your waist is gonna be like chef's kiss. But I do think that there's a lot of products around this idea, like get your baby body, your pre-baby body back, or even just in, I pay attention to physique competitors.
Yeah.
Like the physique competitors are always selling some kind of waist trainer.
Yeah.
And that's like that's the key or whatever, at least that's how they sell it. Like that's the key to their competition prep or whatever. And I don't actually think, maybe it is, I don't know. Competing is an extreme sport, so that's sort of an outlier. But
right.
I do think for the general population, a waist trainer is not, even for some of the purported benefits around posture, which you've mentioned a couple of times.
Yeah.
And maybe we can go there now. I don't think that the waist trainer even provides the right type of, it might provide like a physical reminder if you're like slouching over
Sit
and then
up,
the waist,
yeah,
like to sit up because the material is crunching. What are some things that we can think about either training in the gym or at home, or ways that we can improve our posture as we age? Because that's a big thing I would see in practice. I'd have women coming in saying, I don't want to look like my mom. Like
I know.
my mom looked, she looked rolled over. She had this big dowager hump. How do I not look like that when I age?
Well, it's so hard now. Who doesn't have a tech neck and is looking down at a computer on the phone like 50% of the day? So,
right.
So from a pelvic floor perspective, the pelvic floor works best in what we call a neutral spine, which is when your ribs are stacked over your pelvis. So that's when I'm kind of sitting upright. I'm not super arched back. I'm not like sticking my chest out, but I'm also not rounded, sitting in what we call a sacral sitting posture, where I'm kind of like rolled forward. Your ribs are stacked over your pelvis. And so one of the ways I actually tell people is to put on a sports bra and have on a pair of pants or a pair of underwear. And the base of your sports bra, the bottom line, should be parallel with your underwear, right? Mm-hmm. So if you're sticking your butt out, it's like, there's actually it's going to be shorter in the back and longer in the front. Or if you're sacral sitting, it's like, the front's crunched down, the front of the sports bra is touching closer to the underwear, and then the back is really long. So and this is the posture you should have when you're working out. You want that nice neutral spine position, and that's going to give that pelvic floor space to activate. And that's actually how we should be sitting during the day. But I'm short, so I'll sit on my couch and my feet don't hit the floor. So I put a pillow behind my back to kind of keep myself upright. I have like the most nerdy car setup where it's like a really up back and and it's like I'm so close to the steering wheel. And I even watch my kids. My kids are on screens and I'm like, oh my gosh, this kid is already having like rounded shoulders. And I'm like, put a pillow behind your back, lift your computer onto your lap desk. And because these repetitive postures affect how we breathe, they affect our pelvic floor, they affect our core strength. And this is what I think is so important, and what I really try to nail down in the book is like, you can do all of these exercises all day. But if you're just not looking at the daily habits you have and making these small adjustments, then it's kind of like you're swimming upstream, because some of these things are just really simple and basic and easy to adjust, but they go a really long way. And so, with waist trainers, again, it's one of those things where that's why I love compression. I want to give something where people feel like they've got a little bit of, something pulling their tummy in. I remember pulling my postpartum leggings like over my belly because I just felt like I needed a hug. And that's really what you're looking for, is that gentle hug in while you activate your inner core versus a squeeze and pressure down.
And you were saying the vaginal or the vulvar compression, is that underwear? What is that? I've never heard of that before.
It looks like underwear, but it's like a girdle almost, but it pulls up. It's like underwear that goes really high, right? It's like a high-waisted underwear, so it comes up, but it's a compressive nature. It's almost like a sports bra-like material. My favorite brand is called Love Steady. They have amazing postpartum ones. There's another one called Hem Support Wear. All of these kind of just like give your pelvic floor and vulva a hug because there's swelling down there as well postpartum. But at any time, I mean, I have a woman who's postmenopausal right now, and she doesn't have great posture. And she's like, I feel like I have a little bit of diastasis, but I also have prolapse in my history. And so we got her a pair of these Love Steady bloomers, and just to kind of help pull her pelvic floor in and give her a little bit of compression that feels really nice and cozy, but it's not so tight that it's squeezing you.
And you could use that when you're working out.
Oh, yes, absolutely. When you're walking, when you're working out, you can wear it all day. I just tell people don't wear it when you're sleeping. You don't need it when you're sleeping.
Right. And that's sort of the time when you'd want there to be like that laying egg that you were talking about, like that relaxed and open.
Yeah.
Beautiful.
Yeah. So one of my favorite ways I teach people to poop is, I talk about blowing to relax the pelvic floor muscles. Again, something we're never taught to do, but thinking about laying an egg. So like when you're pooping and they're like, I don't know how to push. I'm like, just think about laying an egg and like that sphincter opening up. And that's how we teach people to give birth as well. Like we're never really taught how to birth. You just kind of get into this room with like doctors and a lot of lights and they're like screaming at you to push. And I'm like, well, nobody's taught you how to push. And now you're in this really vulnerable, overwhelming situation, potentially medicated. This is why it's so important to help women during these processes understand their bodies and learn how to use them so that we decrease the risk of pelvic floor issues.
And with that laying egg, that would also apply. So if someone is having the UTIs that we were talking about, the painful orgasms, the tampon insertions, painful, all the sort of signs and symptoms that someone might have a tighter pelvic floor, that might be, it's like the test is sometimes also the therapy, right? That would also be something that we would be encouraging women to be doing as a way, that laying egg, bearing down, opening up and stretching. That would be something that would be, I mean, there was also massages and there was tools in the book, but yeah.
I would say the laying an egg, it's a little bit more functional. Like you don't want to walk around kind of pushing your pelvic floor out all day. But I think when you are using the restroom or you're trying to, like in a very functional way, times that you need to really relax your pelvic floor, that's what you would want to do. If you're trying to insert a tampon or insert a dilator or have a bowel movement, I want you to practice that laying the egg. And I tell people, which is a very big ask of me, to like take a mirror. Like you need to see, it's called biofeedback. You need to see how your body is responding to what you're trying to communicate with it. So if you do a Kegel contraction or a pelvic floor contraction, you should see the pelvic floor muscles kind of tighten and your butthole pull up and your vagina close. When you push out or laying egg or bear down, which is what you're doing with a bowel movement, you should see the anal sphincter open up and push towards your feet. So we can't see what's going on down there. So often taking a mirror and just looking is an easy way to do it.
Oh, I'm so happy you said that. I think that it's such a simple thing, but it's so elegant in its solution, right? How many women listening, be honest, have taken a hand mirror and actually examined yourself? I think that so many, comes back to what we were talking about before, this like shrouded in shame, right? It's like you have the incontinence liners at the pharmacy and here's the medications for an overactive bladder with the promise for a better life. You have all these medicines that are being in commercials that you see in between your shows or whatever, even like the scented vaginal washes, like there's douching, no. Never.
No douching. No, even just cleansing. It should be very mild, gentle. Even sometimes water's fine. But, I think that it feels intimidating. I mean, this is like, I don't like look at my vulva every day, but I'm like, if something's going on, like I need to see. Like I need to know what my normal is. So if something's not normal, if it's really red, if my labia are thinning, if there's dryness or redness or irritation, or if I have hemorrhoids, like you kind of need to know. And I think that we live in a culture and society where this part of our body is often considered dirty or shameful or embarrassing. And so we don't address it. But if we don't address it, then we don't get help when we need it. And so I really look at this as like any other part of our body. It is like an elbow or a knee. I'm in medicine, I'm a physical therapist. So this is just a body part for me. And I've worked with tens of thousands of women over the past 18 years, and it's just a body part. And so they're like, oh my God, is it weird? I'm like, it's like having coffee talk, but I'm working on your vulva and vagina. But I think if we really kind of just bring it down to the anatomy and the understanding of it, it just makes it less kind of, awkward or uncomfortable or mystical. And it can just be like, oh, this is my body, and this is what it is, and this is what it does, and this is how I need to take care of it.
And so would the first point of contact be pelvic floor physical therapist? Would we talk about this first with, you mentioned before, you can go into any PT's office.
Yeah.
You don't need a referral. This is a common misconception. I think you can go into most physical therapist office without a referral from a medical doctor. That would be your preferred first point of contact. Would you speak to a urologist first, or what would be
of course. You can always speak to a urologist, a gynecologist. So a urologist is going to be more for a bladder issue. A urogynecologist is a kind of a female pelvic floor specialist if you've got prolapse or bladder issues as well. A gynecologist for any sort of sexual dysfunction or pain. It is unfortunate, though, because a lot of these physicians aren't educated on what pelvic floor therapy is and how it can benefit their patients. So if you have constipation, you go see a GI doctor, they're going to be like, okay, take the Senna, take the stool softeners and the Miralax, and then come back, and then we'll scope you if we can't figure out what it is. But it literally could be like your butthole's not relaxing when you poop, right? Or you have vaginal pain, and they're like, oh, well, the results are all negative for infection, but take this antibiotic and, use this antifungal, and then like come back in 6 months if it's still there. When I'm like, well, maybe it's muscle spasm or scar tissue, or it's a combination of things. So I think that my hope is that physicians and all other medical providers just start to integrate pelvic floor therapy as part of the care model for anything going on in this region. And if it's not a muscle issue, then we're like, okay, it's not a pelvic floor issue. We've at least ruled it out. But it can take months to years for people to find us. And by then it's a chronic condition. And it's been going on for much longer, and it takes longer to unwind. So I think that if we can integrate this care sooner and more effectively, we're just going to help improve the quality of life for women way faster.
Thank you so much. Yeah, thank you so much. And hopefully coming on shows like this will help to spread awareness and for women to maybe see a little bit of themselves in this conversation. Maybe some of them are like, oh, actually, I think I do have a little bit of stress incontinence, or didn't realize that that's going to put me at a higher risk for fecal incontinence or being in a nursing home down the line. So I hope that this conversation was eye-opening. I know certainly was fascinating for me. I loved talking to you. So your book, Floored, your Instagram handle, the best, the Vagina Whisperer.
Yes, the Vagina Whisperer. That's right.
You mentioned that you have a course as well. Is that for practitioners or is that for the layperson?
It's for the layperson. So my book, Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage. It's available June 10th, so depending on when this comes out. And I recommend it for everyone, whether you have a daughter, a parent, or yourself. But I think it really kind of breaks down this part of your body. And especially if you're a medical professional, to kind of really understand what goes into the work that we do. My Instagram handle is The Vagina Whisperer, where I have like lots of videos and content. Sometimes I'm wearing a vulva costume to do that education. And then my online workout platform is called thevaginawhisperer.com, and it's online exercise programs that people can do at home, whether you're in therapy or waiting for therapy or just want to try it at home. It really walks you through both relaxation if that's needed or strengthening.
Fantastic. I think everyone should pick up a copy of the book as a starting place. And there's a lot I can say from reading the book. There's a lot of manual instruction in there, which is very, very helpful. You go through the anatomy, what it means, what it looks like. You do clock diagrams. It's so well done. So just congratulations. And I will make sure that this is all linked for everybody. And we'll see you soon.
All right. Thanks so much for having me.
So how's that for a fantastic conversation? I think my absolute favorite, bar none, part of our conversations is when we were talking about renaming Kegels to puss-ups. I think that is how I'm going to refer to them going forward, even if no one else does it. It's going to be me and Sara just calling them puss-ups. Loved this conversation for so many reasons. One, Man, we just don't talk about this. We don't talk about pelvic health. I think the stat that she said was 1 in 3 women experience some type of urinary incontinence or pelvic health issue postpartum, which is why she's here. So loved the part of the conversation where we were talking about the difference between a pelvic floor that is too weak. So, the stress incontinence, the urge incontinence, the fecal incontinence, the feeling like maybe when you're working out, if you're lifting weights or you're running or you're jumping, there's a little bit of pee comes out. Loved all of that and contrasting that with a pelvic floor that might be too tight or might have some points of tension in it. And we talked about constipation, the number one issue for women, the different types of constipation and what to do about it. I think that that was a really big highlight for me. I think that she had so many action items, right? Like squeeze before you sneeze. And some of the garments that she was even talking about, you can probably tell in the conversation, I had never heard of them before, that compress and just give a little bit of support to the pelvic floor while you're working out. So then when you squat, you don't pee. That's great. And then there was a tampon-like insertion that you could also insert into the vagina to help with leakage as well when you're doing high intensity activities. So I loved this conversation. I hope that you found it informative. Maybe you saw yourself a little bit in some of the descriptions that we were talking about in terms of either a healthy pelvic floor, a pelvic floor that needs some love and maybe a little bit more puss-ups, as we are now calling them, or we need to relieve some tension. And I think that this is one of those conversations that has really meaningfully impacted me. Of course, I talk about the neuromusculoskeletal system all the time, and I have in practice with seeing patients, I have done some pelvic floor health rehabilitation, and I mentioned it in the show. We're talking about hypopressives. It's funny that she was like, those are really popular in Canada and the UK, and I was like, yep, well, I'm in Canada, so that's like really popular where I am. So I've prescribed like lots and lots of hypopressives for women, but loved the conversation. And I hope that it impacted you as well. And maybe it has changed the direction or integrating some of the care and the techniques and the tools that we talked about on the show. So let me know what you think about this episode, either on Spotify or Apple reviews. We'd love a 5-star podcast rating if you feel like it is worthy of that. And until next time, I bid you adieu. Have a great day.